Welcome to the Healthcare Redefined podcast, where we advocate for aging adults and their families. This is where we empower aging adults and their families to navigate the healthcare maze with confidence and also with compassion. Hi, I'm Pam Dunwald.
And I'm Linda Kritikos, and I am so excited about our first podcast. We're both registered nurses and board certified patient advocates who own and operate Your Nurse Advocate Consulting. We have over 80 years, that's a lot, of combined experience supporting families just like yours.
This is our very first episode, and we are so glad that you're here. Our goal is pretty simple. It's to be your trusted guide throughout the confusing, often overwhelming world of healthcare, especially when the system doesn't work the way it should.
Yeah, and sometimes it doesn't. So today's episode is called When Systems Fail, Managing Gaps in Healthcare. If you've ever felt lost, frustrated, or even scared when trying to get care for yourself or a loved one, you're not alone. This happens a lot these days.
Healthcare is complicated. Even the best hospitals and clinics, they can miss things. Maybe you've experienced delayed in test results, maybe confusing discharge instructions, or endless phone tag with insurance, or getting lost in the sea of the props. These are all gaps, moments when the system that just doesn't deliver.
Yeah, so let's talk about those gaps. What do we mean by that? These are the places where communication breaks down, follow up falls through, or patients and families are felt to kind of figure things out on their own with pages and pages of documents that they can't understand.
Gaps can show up in many ways. For example, discharge instructions that don't make sense to you, medication changes not communicated with your pharmacy or maybe with other doctors or providers. There's no one, really coordinating what's going on between your specialists. Maybe your orthopedics not speaking to your cardiologist. There's missed referrals or lost paperwork. And then there's the insurance denials where they have little explanation. All they're saying is they're not paying.
Yeah, and this is really compounded as we age. So for older adults, these gaps can have really, really serious consequences, such as medication errors, preventable hospitalizations, or families feeling completely overwhelmed and underserved.
Why does this happen? Sometimes, it's just a lack of time. Sometimes there's too many cooks in the kitchen. There's not enough communication between doctors, nurses, pharmacies, insurance companies. And sometimes the system just isn't designed to support families as they navigate complex care.
So we want to make sure that you understand it's not about blaming individual providers or systems. Most healthcare professionals are doing their absolute best. And we know this. We've been part of the healthcare system for a long time, but the system has really, really gotten really big and it's very complicated. And it's not often set up for a seamless, person centered care experience.
If you're listening, you might be an adult child caring for a parent, or maybe you're managing your own chronic condition. You know how stressful it can be to fill in the blanks, calling for results, tracking down answers, and advocating for a loved one.
Well, that's where we come in. Advocates like us come in to help make your life easier. Our job is to help you see the whole picture, not just a portion of it, and connect the dots and make sure nothing falls through the cracks.
Linda and I are each going to share a story. So, just briefly, this would be an example of when the system failed. And, was one with my own mom. She was in the hospital for 9 days, had some new healthcare changes, new diagnosis. She had four specialists, including a cardiologist. They put her on a new heart medication, caused her blood pressure to crash. They had to use medications and to IV medications to bring her blood pressure back up. Follow up after her nursing home stay, follow up with the cardiology as an outpatient. The cardiologist wanted to start her on the same new cardiac medicine they started in the hospital that caused her blood pressure to crash. And he tried to tell me, I was on speakerphone listening in and participating. He tried to tell us that it wasn't that medication that caused her blood pressure to drop so significantly. And I had to be very firm and say, please read the doctor's notes from the hospital because they'll tell you why they stopped it and why she can't start it. So I actually had to argue a little bit with him. And then he finally agreed, okay, we won't restart the new medication now. We'll look at it in a few months. And by our next follow up appointment, he didn't start her on the medication. He did, I gave him the grace of not bringing it up again. But this is an example when the system can fail you.
Another issue in regards to how the system can fail is it's a little different story than what Pam had just shared. I had a client that was diagnosed with cancer, and he was getting pretty much debilitated. He really couldn't do a lot for himself anymore. So he had asked for your nurse advocate consulting to help him, and I did, and took him on as a client. And one of the things he was asking for is someone just to come into his house to help him prepare breakfast, help him get up in the morning, because he was having a really difficult time getting in and out of bed and meeting what we call activities of daily living and being able to be independent in his home setting, doing basic things. So we interviewed several agencies and picked a couple, and I told them that there's no staffing guarantees, as staffing is an issue with all of these agencies. And they basically told us, both of the agencies, that there was no guarantee that they could possibly provide care all the time, and that sometimes that we'd have to be without. So I had told him, because of his condition and his failing conditions, I suggested that we put a backup plan in place. So I'm very glad we did. We put a backup plan in place because I got a call early in the morning, about 6:30 in the morning, from him. He was very upset, saying, my care staff isn't here. They didn't show up. They haven't been here. They were supposed to show up at 5 a.m. Nobody showed up. Here it was, 6:30 in the morning. Nobody was there. He said, I can't get out of bed. He says, and I haven't gotten my pain medication. What am I going to do? So I said, it's okay. Take a breath, calm down. We put our backup plan in place. The backup person showed up. The backup person was able to provide the care. I followed up with the agency to find out why this happened, why he wasn't notified. Things were then corrected, put into place so that this didn't happen again. But again, sometimes it's these very simple things that cause a system to fail, and it's not necessarily anyone's fault. It just happens. Let's look at what you can do to find yourself if you find yourself in one of these gaps. So here's a few tips that we found both Pam and I have been helpful with others. And that's keep a notebook. Write down every doctor appointment, medication, and question you may have. Always ask for written instructions. Don't leave without clear, easy to understand directions. A lot of times they'll give you an after visit summary. Sometimes it's not as concise as you would like it. So please make sure you have the information on there that you need. Also, know your medications. Keep an up-to-date list and double check it every single time you go to a provider. And make sure, if you have multiple providers, that you give it to all providers so everybody is on the same page. And please don't be afraid to speak up. Use your voice. If something doesn't feel right, it probably isn't. So please ask for clarification, and always build your support team. You don't have to do this alone. Reach out for help, and that's what we're here for.
And one of the things that we can do is in the show notes, we actually have a free resource for you along these lines where you can prep for the doctor appointment. We have a nice form to fill out. So when you go in there prepared with your questions written down, you're less likely to forget them because you're not going to feel rushed. You're going to have them right in front of you. So remember, it's okay to ask for an advocate, whether it's a family member, a friend, or a professional like us. Having someone in your corner can make all the difference.
So at Your Nurse Advocate Consulting, we are fully independent. So that means we don't work for a hospital. We don't work for an insurance company. We don't work for a clinic. We work for any insurance company. We are truly your advocate. We are here to help and work for you.
We help families really navigate the tough stuff, the care planning. How do you get a caregiver in the home? What happens when your loved one has dementia and you need more help? We help with doctor's appointments. We participate. We can help with medication management, in those moments when the system just isn't enough.
So Really, if you're feeling overwhelmed, or you just need a second set of eyes, or you just want another opinion, please reach out to us. We offer a free newsletter, virtual support, and a community of people who really do get it.
We want to thank you for joining us up for our first episode. We hope you feel that you've been seen, heard, and supported.
So if you like today's show, please subscribe, share it with a friend, check us out on our website at yournurseadvocateconsulting.com for free resources and all upcoming events.
And if you have a question or a story you'd like to share or a topic that you'd like us to address, please email us. That would be great. And that's just at info@yournurseadvocateconsulting.com. We'd love to hear from you.
And remember, you're not alone in this journey. Together, we can bridge the gaps in healthcare, one story and one family at a time.
Thanks for joining us. We'll see you next time.